Anyone can contract RSV, but the virus is especially troublesome for young infants. In this episode, HSHS St. Anthony's Memorial Hospital Chief Medical Officer Dr. Ryan Jennings gives us more background on the disease and ways to prevent its spread to our population's most vulnerable.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we've got a familiar guest to the show. We are welcoming back Dr. Ryan Jennings, the Chief Medical Officer of HSHS St. Anthony's Memorial Hospital. Welcome back to Being Well.
Thank you. Thank you for having me.
Of course. And so we're familiar with you around here, but for folks who maybe haven't got to meet you yet, can you introduce yourself a little bit and what does it mean to be a Chief Medical Officer?
Sure. I'm actually an internist and a pediatrician by training, so double boarded so that I went to med school right up the road in Springfield and then returned to Effingham, was in private practice for several years, and now work as administration primarily, and the chief medical officer role is kind of fun because it lets me really focus on kind of quality initiatives and things like that that don't necessarily impact the individual, but have a broader impact as you look at how you move healthcare as a larger entity. So a lot of fun with that. I serve here as well as in Greenville, Shelbyville, and formerly Decatur. So I work in many locations, have a lot of fun.
You're putting a lot of miles on the vehicles
I
here.
do, yeah.
Running around a little bit. Well, today we are talking about RSV, which is something that can definitely impact our younger folks, but we'll talk about younger folks, older folks, the whole gamut. So for folks who aren't familiar, RSV, what does that stand for and what is it?
So it stands for the name of the virus, which is respiratory syncytial virus, which is not too tough to say. Better than some of the.
But I'll let you handle it.
Better than some of the things that we come up with, and unfortunately, it's still one of the number one reasons, and in fact, the number one reason for childhood hospitalization with a respiratory illness, and very common. Almost every child by the time they hit age 2 will have had an episode of this particular virus, and a percentage of those will end up in the hospital. And unfortunately, of that subset, then some of those get really sick. So it's actually a pretty significant burden on the healthcare system as far as the number of patients that are admitted, and the things that happen if you're a parent of a child and you're off work now for probably a week, because you got to take care of the kid, and all the things that happen when you have somebody that is significantly ill. And yet is one that we hope will become progressively more treatable, and we'll talk a little more about that too, I'm sure, but progressively more treatable and preventable as we evolve vaccines and those types of things. But right now, it's still a big deal. We went through a big respiratory deal here lately, with COVID and things like that. And when that happened, I think we kind of lost focus maybe around RSV and some of these other respiratory illnesses that are still very serious and impact an enormous number of folks, and yet they went down because we were masking partly, but also just, folks were not out and doing the things that they were doing. Now that we're back hopefully to normal life, we're going to see more and more RSV.
Definitely crossing our fingers that we could be out of the woods with COVID. But I think you bring up a really good point, because I think as COVID was kind of evolving, a lot of people were noticing like, well, where did the seasonal flu go? Where did all these numbers tanked? But like you said, those viruses were still there. They just weren't the focus. They
weren't the focus, and truly the same things that we did to prevent the spread of COVID are the exact same things that help to prevent the spread of influenza, of RSV. So distancing, and the one thing that I don't want us to ever learn a lesson or lose the lesson around is hand washing. And boy, did we learn to wash our hands during the COVID pandemic more than ever, and use sanitizer and those types of things made a difference.
Yeah, seeing those numbers
for
go down.
sure, those numbers went down, and across many diseases. So everything has a silver lining.
Well, and you might have hit on it a little bit, but as we're talking about RSV and it impacting our youngest patients really hard, it's kind of easy to guess, but why is it so rough on our youngest patients when they contract RSV?
Sure. RSV is kind of funky because it's a snot problem.
Okay.
in plain old terms, it's just, you get so much mucus that people that infants specifically can't manage it. I mean, it creates so much mucus that with those little tiny nose holes and those little tiny airways, and you throw a little bit of snot in them, and they just can't breathe. And it's a disease that affects that system directly, the respiratory system, around the idea of production of mucus. And honestly, most of what we do for RSV is centered around just trying to suck out snot and give oxygen if you need to, and make sure that nobody gets dehydrated, because in those little babies, for sure, which is the population that ends up in the hospital most often are the little bitties, and they get to the point that they're not able to nurse because they're so congested that they can't. I mean, just can't breathe, and so then they get dehydrated, and then you're dehydrated, and so it kind of feeds on itself. And so I think it's just kind of, I always laugh but it's funny because it's snot. It's the problem.
Right. They just can't manage it.
It's just so much mucus that it just becomes unmanageable, and you need help, or you're dehydrated, and that's what leads those little tiny ones in. And if you think about a straw, I mean, if you think about a normal adult, so you, me, that type of thing, our windpipe's about as big as our thumb. In an infant, your windpipe's not even as big as your pinky, and if you pinch off that halfway with snot, you can imagine that it just becomes impossible to be able to get a good breath. And so that's what leads folks into the hospital. And thankfully, most children will do just fine with just simply a little bit of time, rehydration, suctioning out snot. Breathing treatments sometimes help. A lot of time those breathing treatments, though, don't need to be anything special. They're just water, just to kind of loosen up the production of mucus so that it can be sucked out, so it doesn't take a lot of really specialized treatment. And then oxygen if they're at a point that they need that.
Well, and it's heartbreaking to think, like you said, they already can't breathe, and then if they can't breastfeed and they can't get the nutrition that they need, so on top of dehydration, and they're not, able to grow like they should be and fight it off like they should be, it's just like a triple whammy all at once. And like you said, all over the snot,
all from snot.
All from snot. So as we move on to a little bit older patient, so how would it present in someone who's, say, maybe my age?
So we probably have this virus many times in our lifetime collectively. Over the years, you're going to get it every few years, and typically just be a common cold. You won't even think too much about it, and especially in that age group that is very healthy for the most part, so they're out of the childhood range and they're into those golden years as I enter my golden years that don't seem to be that gold. But then as you get into that age group, well, and you have other health problems, especially you have heart disease, you have heart failure, you have diabetes, you have all those other things. If you get infected with RSV, then it can become very serious, and once again you're on the receiving end of a virus that causes so much mucus production that if you don't have an effective cough, if you're not able to do those types of things and you're not active, you end up in the hospital. And so we will see RSV in the hospital on both ends of the spectrum, both at the very young and also in the older population, and especially those that have other comorbidities that predispose them to becoming ill. So, and then it looks more like a pneumonia. I mean, they'll get sick and run fevers and the kind of things that you expect to see as a typical pneumonia. Treatment doesn't change a lot, unfortunately. At this point, we still are pretty limited on what we have for treatment. Almost everything we do is supportive, meaning helping to suction things out, helping to clear the airway, giving oxygen where it's needed. There's not a magic medicine, and although we're working on those like we are on so many other projects, there just isn't one yet.
And I find it interesting that, we talk about how treatment had really ramped up and mitigation efforts for COVID had really ramped up. And it's like, if you throw enough brain power and money at something, something good will come out of that. And so with RSV being so serious, you would hope that something, is coming down the pike with that.
Absolutely. And I think we learned a lot from COVID about that, exactly that when you really get public attention, which is why we're having this conversation around an important disease, then that investment of time and brain power is just amazing what we can do in very, very short time.
And even around cold and flu season, whether it's RSV, flu, COVID, like you said, the washing the hands, the staying out of a young baby's face type of thing. Like, I have seen so many posts of mothers talking about how, the grandparents want to come up and, pinch the cheeks of the baby or give them a kiss or whatever, and they're not built to handle our big people germs.
That's right. And, certainly during those first couple of months, kind of laying low, not getting out in the community, especially when there's certain, things circulating in the community, like RSV or COVID or flu or really trying to just make common sense, keep distancing and be safe around it. I certainly never want a grandparent to not get time with their grandchild, but even with that, doing that within your own home is different than going out into the general public. And it's always exciting with a new baby and those types of things to get out, but it's probably best waited until the baby's immune system's just a little bit more mature, where they're ready to kind of tackle the big person bugs.
And we've been talking mainly about mucus here. So other than the, increase in snot in the system, what are some other hallmarks, if we could dive in a little deeper, of RSV? Will I have a fever or those type of things?
No, and I think what's important is because it looks just like a cold.
Okay.
Up front you would think just a cold, kid's snotty, every kid's snotty. You just don't even think too much about it. What this one then, when you become worried, is more when one of a few things. One is, like we talked about earlier, difficulty with feeding, where they're so congested that they can't feed. You don't have wet diapers, you don't have poopy diapers, they're just not able to get enough intake, and you start to worry about dehydration and things like that. Two is just how hard they're working, so there's one thing to kind of be coughing and snotting and doing what you do with a cold. There's another thing where you see them where they're really pulling, where their chest is moving to try to catch their breath. They're using their belly to breathe, where they're pulling in with their belly to get a full breath. Those are the reasons that you need to go to the emergency room and really have a definitive evaluation by a doc, regardless of whether it was RSV or not. I mean, those are kind of the warning signs of somebody with a respiratory illness that says, hey, this isn't just garden variety illness. let's go in and get a double check, because a few of them do get that difficult. And so those are the things I would look for. But really, again, especially in that kind of middle age group, it just looks like a cold. Wouldn't know you have it. Yeah, I mean, you know you have it, but
Right.
but you wouldn't necessarily even not go to work. I mean, you'd be okay. And then the older population, very similarly, they tend to then get sick and run fever, confusion. One of the most interesting things about adults, especially older adults, when they become ill, you tend to see a lot of confusion and disorientation, and that's always a sign that you need to be seen in a hospital, because that means that you're on the other side of the curve. I'm sick, I'm over here, I'm kind of doing my thing. When I get over here and I'm confused, I'm not myself, I'm not just sick, but I'm out of it, that's, you're come to the emergency room time.
I'm sorry if it's a dumb question, but what's causing that?
So it's actually, most of the time, a lot of it is triggered by our own response to the illness. So when we have a intruder come into our body in the form of RSV or other viruses, the body attacks that and fends it off and hopefully takes care of it. But sometimes when it does that cascade of inflammation and just so many things in the body working to tackle that infection, it'll tackle things that are good for you. So it'll tackle yourself, so to speak, and that can lead to confusion. Sometimes the infection themselves releases toxins that cause confusion, and of course part of it, for good or for bad, is just as we age, the mind becomes one of the weaker links, and so deficits that are minor day to day become really obvious when you're not feeling well. So just like when you're tired, and you go, when I'm tired, I ran a stop sign. I wouldn't run a stop sign if I wasn't tired. Same type of lapses in cognition happen when people are very, very ill. And so we see that very commonly in older folks.
Yeah. Well, there was an earlier episode of Being Well this season where we had talked about sleep debt. And it's like if you take and take and take from this bank, all of a sudden you can be so sleep deprived that it registers like you are a drunk driver. So
Correct.
It's funny that you mentioned that, because it's all connected.
All that training was done about doctors in residency.
Yeah.
All those studies were done about doctors in residency.
You've lived it, you know. For sure.
I'm not even kidding. That's true.
Yeah.
But no, very much. And so the mind just becomes the weak link.
Mm-hmm. Well, and as we're talking about treatment, you've talked about in the hospital just some vapor, oxygen treatment. If I am somebody who is dealing with this at home, and it may be more feeling like a cold-like type of thing, do you have any suggestions of what kind of over-the-counter type things or treatments I should seek?
Absolutely. So first, of course, is looking out for the bad things. So looking out for the child or adult that's having trouble keeping themselves hydrated and those types of things, or those that are working so hard to breathe that they're visibly working, they're pulling, their chest is pulling. So first is that. Then it's the comfort thing. So if you have fever, and not everybody has fever with this, but most do, the Tylenol, ibuprofen, it doesn't change the course of the illness, but if you've had a fever, and I'm sure you have, you sure feel better when the fever's down,
Yes.
and then that helps you to stay hydrated and get up and move around the house and stay active, which helps then to make sure that you don't get a pneumonia or something from laying around. So staying active, infants are obviously a little bit of a different story, but Tylenol, ibuprofen, those types of things for the symptoms, and of course dosed with the assistance of your pediatrician for those little babies, because you got to be safe around what medicines you're doing there. And humidified air. Honestly, humidity, the good old vaporizer in this disease, especially with all that mucus, humidified air.
Nice hot shower.
Exactly, just to help loosen up that mucus. Cough suppressants, those types of things, certainly in the younger population have very much fallen out of favor. There's a disease process that needs to do its thing, and suppressing that cough may not be the best thing, especially in a young population. In an adult population, sometimes you need something just so you can get some rest.
Yeah.
But in the younger population, a little bit different story. So certainly consulting your pediatrician about what type of over-the-counter remedies they would suggest. But most of it's just good old chicken soup type stuff for the most part.
Yeah, kick back, watch your favorite shows, and stay home if you're sick.
It's a good excuse for a binge. A little
Little stream watching.
Yeah, stream watch PBS.
Oh, PBS.
We should stream watch PBS.
Of course you should. Subtle plug. Now, in our conversation, I've heard you mention a couple of times pneumonia. Now, are they different bacteria, viruses? It sounds like one can lead to the other.
Very much so. So one of the complications that you worry about with not just RSV, but any of the respiratory viruses is kind of a two-phased illness where you start out with the virus, which most viruses have no treatment, and RSV is no real exception to that. And so you start out with that, and maybe you think you're getting a little bit better, but you've been laying around, you've not been up, you've not been taking deep breaths, you've not been coughing, you've not been doing the things to keep things moving, and then a bacterial infection starts in the lung at the same time, and you get a classic pneumonia. So when a physician's talking about pneumonia, most of the time we're talking about a bacterial infection of the lung. Different ball game, and so you see this two-phased illness. So if you have the kiddo that looks like they've got RSV, they got snot, they're doing their thing, they're sick for 4 or 5 days, and they get better, and then at day 5, 6, 7, 8, they suddenly spike of 103-degree fever, and they're sick as a dog again. That's very concerning that there's a secondary bacterial pneumonia that has kicked in. Same in adults. Adults do the exact same thing, and pretty notorious after influenza. I mean, folks get so sick with flu, their fever's hot and they're miserable and sick as a dog, and then they kind of get better, but if then 2 days later, suddenly they're real sick again, that's always a person I worry about, because that generally means they've developed a secondary pneumonia, and they can get terribly ill with that next wave. So always a red flag when you do a biphasic illness, where it's got two parts to it. That's always a reason to get in with your provider and ask, hey, what else is there?
And I know everyone's situation is different, but do you think that maybe someone who is living with comorbidities would be more susceptible to have something like that happen?
Definitely so. I mean, obviously more susceptible to just almost anything, but also more susceptible not just to catch it, but also to have a complication like a secondary pneumonia or, you name it, simple things, just skin infections, you name it. Any of those folks are always somebody you got to keep a special eye on. And as we all have parents and grandparents and those types of things, you got to have a special eye on those folks.
Right. So after we've been kind of in this pandemic mode for the last couple of years, is there any different way that our kids' bodies are maybe reacting after kind of being shut in for a couple of years?
So that's such a really...
Is it a dumb question?
No, it's a really interesting question, because to the comment, to talk about earlier how we didn't see as much flu and we didn't see as much RSV and we didn't see these things, there is a camp of question of whether that's good or bad, as far as your immune system and your immune system building up responses to certain diseases. And I think the answer is not entirely known on the COVID story, but asthma is kind of the classic example of a disease that in a country that maybe doesn't spend as much time and energy around air purification and keeping the air perfect, there's almost no asthma. If you go into a developed country where we're very attentive to that, we see a lot of asthma. And so the immune system response to being exposed to outside pathogens, viruses, et cetera, is definitely part of what has to happen in order to not then have an immune system that overreacts when it is exposed. Certainly, the classic example with asthma is children that grow up with pets have a much lower incidence of that than those that don't, because they're around that from the get-go.
Yeah.
So the body learns about it and adopts around it, adapts around it, and it's different. So whether or not the COVID story will play out similarly, that we've had a generation here or a couple years of folks
Kind of cushioned,
yeah,
like
that
in a little bubble.
that we're in a bubble. Yeah, and is that a good thing or a bad thing? I don't think we know yet.
But it'll be interesting to see.
It sure will.
As we're in our last couple of minutes here, I'd love to give you the floor just to kind of share some doctor's advice as we head into cold and flu season. We all know it, but I think it's always good to repeat and let you share.
Well, my mantra is always hand washing.
Yes.
You know, that's really probably the most important thing that we all do, and always thinking about hand washing before you eat. You know, this hand-to-mouth behavior transmits almost everything that we deal with. So making sure that you cleanse your hands is probably the most important thing. I used to, my grandmother's house, she had a sign as you walked in, just on a Post-it note, and all it said was, wash your hands. Just that. And yeah, she lived to 93, so maybe there's truth to that.
You know,
but there really is that. And then vaccinations are an important thing, especially for you know, those diseases that are vaccine preventable. And by hopefully the time that this fall rolls around, we'll have some specific vaccines around COVID. On the RSV front, we're probably still a few years out, actually. They've been working on it for 40 years. It's a tough egg to crack.
Yeah.
But sooner or later, we'll have something to help us out on the vaccine front as well.
That patience will pay off.
It absolutely will.
Awesome. Dr. Ryan Jennings, thank you so much for coming on Being Well.
It's my pleasure.
Of course. And we hope our viewers will join us for our next episode. We'll see you then.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.